Hey Annie, I'm the PA student Sarah. I'm going to be performing a physical exam on you today. First off, I'm going to start with the general survey. So I'm just going to assess your overall appearance, your level of consciousness, your emotional state, looking to see if you look like you're in any distress or pain, and then your overall health and hygiene. Okay, so now we're going to move on to the vital sign portion of the exam. So first, I'm going to check your blood pressure. Okay, so if you could just make sure your legs are uncrossed, that's perfect. I'm just going to lift up part of your gown and place this blood pressure cuff around. Now this might be a little bit tight, but just let me know if it's ever too uncomfortable, okay?
Okay.
Try one more time, your arm is really small.
Sorry.
That should be good that time.
That feels good.
That feels tight?
That feels perfect, yeah.
Can you still breathe?
Mm-hmm.
Okay, awesome. Okay, perfect. Let me take this off real quick. Having a good day today?
Oh yeah.
Oh yeah.
Couldn't be better.
Okay, perfect. That was 110/72. That's awesome. Let me go ahead and take this off. Okay, now I'm going to be checking your heart rate real quick. Okay. Perfect. Okay, perfect. That was 65, and now I'm going to be checking your respiratory rate, okay?
Okay.
Okay, perfect, and that was about 14, okay?
Awesome.
Okay, so at this point I would take your temperature and assess your oxygen saturation.
Okay.
And now if you could tell me your height and weight.
I weigh 125 pounds. I'm about 5'5".
Okay, perfect. Okay, so that completes the vital signs section of the physical exam.
Okay.
So now we're going to move on to the skin portion, okay? So first I'm going to take a look at your skin, noting the any changes in color, moles or lesions anywhere on your skin. So I'm going to take a look at the arms first, making sure to check between the fingers, the palms, all that. Same thing over here. Good. And then doing the legs now. Same thing, looking between your toes, making sure to look underneath your feet, all that. Good. Now if you could just slip down your gown for me, just so I can check your chest area. Good. Same thing. Awesome. I'm gonna just take a look at your back while you have your gown down. That's perfect. Okay, I'm gonna slip that back up. Okay, now I'm going to just run my hands down your arms and legs to assess for temperature, texture, and moisture of your skin, okay? Perfect. Slip that up for me. Making sure to do both at the same time to compare. That's awesome. Now go ahead and flip that over. Good. Good. Now if you could just stand up for me. I'm going to check your legs real quick. Same thing. Going all the way down, and then you could just spin around. That's great. And I'm also looking at the back of the legs and checking for those changes in the color and moles or lesions I see, and then also assessing the temperature, texture, and moisture. That's great. You can have a seat back up on the exam table. Okay, now I'm going to pinch a little bit of your skin up to assess for the turgor and mobility. Perfect, looks good. Now we're going to move on to the nail section of the exam. So let me just take a look at your fingers and just looking at the overall appearance of them first. Same thing with the toes, just looking over at the overall appearance of them. Now I'm gonna feel and look at, looking for any abnormalities I see when I'm feeling them. Same thing, looking for any abnormalities when I feel them. Good, same thing here. Okay, now I'm going to perform the capillary refill test.
Okay.
So I'm just going to press down. Good. And then same thing with the toes. You are wearing nail polish, so I can't see, but I would perform this on the toes too.
Okay.
Good. Okay, so now that completes the skin portion of the exam. So now we're going to move on to the hair.
Okay.
So first I would assess the scalp. Oh yeah, good. Perfect. Take that clip out for me. Assess the scalp, the hairline, and the ears. Looking at the hair distribution, or looking over at the overall appearance of it first. And then I'm going to look at the distribution, texture, and quantity of your hair. Perfect. Make sure you check underneath the neck. That's good. Awesome. Everything looks great. Okay. That completes the hair section of the exam. Now we're going to move on to the head. So I'm first just going to look at the overall size and shape of your head, making note of any abnormalities I see. Okay. Now I'm going to press on certain areas of your head. I want you to tell me if you feel any pain or discomfort. Okay. First, let's do the temporal artery. No pain. Okay. Let's do the maxillary sinus, frontal sinus, and then do the mastoid process. And then that should be it for that. Okay, so no tenderness, everything is great. Okay, so now we're done with the head section, and so now let's move on to the eye exam, okay? So this one has a lot more tests, so just bear with me. First off, though, let me grab my little pen. Okay, so I'm just going to assess the overall external appearance of your eyes, eyebrows, eyelashes, eyelids. Everything looks great. Now I'm going to look inside, checking the overall appearance inside, looking for any abnormalities, making sure. Okay, good. Now let me just check the size of your pupils real quick. So just look straight ahead of me. Checking the size of your pupils, making sure it's between 3 to 5. Okay, now I'm going to shine the light real quick just to check the size of your pupil when they constrict, okay? Okay, good. Awesome. Okay, now I'm going to perform the light reaction test. Okay, so this one I'm just going to get you to look right over my shoulder for me, over there. And then I'm just going to shine this light in your eye a couple times, okay? Checking for the direct and consensual response of your pupils, okay? So let's do it real quick. Good. Good. Now over here. That's perfect. Okay. Now I'm going to test the near or accommodation test, okay? So put my finger right here. I want you to look at my finger. Now look at the wall. Now look at my finger. Now look at the wall. Okay, that's great. Now let's do the corneal light reflection test. So if you could just look straight at my nose. I'm going to shine this light real quick and just look right at my nose, okay? That's perfect. Okay, now we're going to test the extraocular muscle and convergence test. So if you could just keep your head straight and just follow my finger with your eyes, okay? Ready? That's perfect. Keep it up. Good. Go over here. Awesome. Back in. Follow in. Perfect. That's great. Okay. Now I'm going to test your visual acuity. Okay. So I have this little handy dandy card right here. And it says at the bottom of this card to hold chart in good light at 6 feet apart from the eyes. So, you know, that's probably like right here. Okay. So now tell me the smallest line. Let's cover up that right eye first, just with your palm. Good. Now tell me the smallest line you can read on my chart.
ECTPNL.
Okay, perfect. Now cover up that left eye, same thing. Let's read it backwards this time, actually.
LNPTGE.
Okay, now with both eyes uncovered.
ECTPNL.
Okay, awesome. That's great. Perfect. Okay, now I'm going to assess your visual field. So if you could just cover up your right eye for me. Good. I'm going to cover up my left eye. And I'm going to show a couple numbers, and you just repeat them back to me, okay?
2, 1, 3, 4.
Good. Now same thing on the other eye. Let's do this.
2, 2, 3, 1.
Perfect. That's great. Okay. So now I'm going to perform the fundoscopic exam, just taking a look at the inside of your eye, okay?
Okay.
I'm just gonna go ahead and dim the lights too if you don't mind, so just so I
Oh,
can
yeah.
take a better look at there. And, oh, what happened if I turned it on? Okay. Okay, so this one I gotta get pretty close to you, so I'm gonna touch your head though, okay? So I'm just giving you a warning. If
Okay.
you could just look straight ahead, and you can look over there first, that's fine. Good, good. Now go ahead and look at me, that's perfect. I'm just gonna get nice and close, taking a look at the inside of your eye, looking at those blood vessels. Okay, that's perfect. Now let's go ahead and do the other eye, same thing. Good. Let's do this eye though. Oh gosh. Gotta switch it up. Good. Good, I'm just gonna touch your forehead, okay?
Okay.
Making sure. Oh, yep. All looks good, that's perfect. Okay. Now that completes the eye section of the exam. So now we're gonna move on to the ears. Moving on to the ears, and first off I'm gonna check the external appearance of your ears, looking for any abnormalities I see. Good, okay, now I'm gonna pull on some parts of your ears, and just tell me if you feel any pain, okay?
Okay.
I'm gonna pull on the auricle, good, tragus, good, mastoid process, good. Any pain, discomfort, okay? Moving on over here. Auricle, tragus, mastoid process, no pain? Okay, good. Now I'm gonna perform the tug test, okay? So I'm just gonna pull down on your ear, just let me know if you feel any pain, okay?
No.
No pain?
No.
Okay, good. Over here.
No.
Good.
No.
Okay, awesome. That's great. Now I'm gonna perform otoscopic exam on you, just gonna take a look at the inside of your ear, okay?
Okay.
Now this one, it's nice and close too, and I'm gonna have to touch your face again, but also, if you have any discomfort, just let me know, okay?
Okay.
Okay, making sure to hold it like a pencil. Okay, let me just start over this way first. Okay. Get nice and in there first. Good. Good, okay, everything looks good. Now back over this way, same thing over here, okay? Okay, good. Everything looks good. That's perfect. Okay, now that completes the ear section of the exam. Now we're going to move on to the nose, okay?
Okay.
So for the nose part, first I'm just going to take a look at the external appearance of your nose, looking for any abnormalities I see. Okay, now we're going to perform the nasal patency test.
Okay.
So if you could occlude one nostril first, good. And then now occlude the other nostril and breathe normally, good. Okay, and first off, we're gonna actually go back to the ears real quick. I forgot one thing.
Okay.
So this is the whisper test, okay?
Okay.
So I'm gonna stand behind you,
Okay.
and I want you to plug one ear at a time. But let's listen to my directions first.
Okay.
I'm gonna whisper a series of numbers and letters, and I just want
Awesome.
you to repeat them back. So let's close that right eye, right ear first. Sorry, good.
A2B.
Perfect. Okay, now I'll cover the occlude the other ear. Awesome.
H34.
That's good. Okay, so we already assessed your nose, the external appearance. We got the nasal patency test. That was all great. Now it's time for me to take a look inside your nose, okay?
Okay.
So same thing. This one has to go up your nose a little bit. So just let me know if you're ever uncomfortable, okay?
Okay.
Good. Okay. Good. Just taking a look at the inside of your nose, see if I notice any abnormalities, okay? Okay, that's perfect. Everything looks good. Awesome. Perfect. Okay, so now we can completed the nose section. Now we're gonna move on. Sorry, that's like way up there. I'm sorry. You shouldn't let me know if you're any discomfort. Okay, moving on. Now I'm gonna be testing the mouth.
Sorry, just my eyes are watering.
Mouth, it's okay. Are you in any distress or pain?
No.
Now moving on to the mouth portion of the exam.
Okay.
I'm just gonna assess the external part first, looking at your lips and all of that. Now if you could just open your mouth, I'm looking at the lips, mucosa, pharynx, palate, if you keep your mouth open, perfect, tongue, and your gums and teeth, good, perfect. And then keep your mouth open. I'm gonna take a look at the posterior pharynx. If you could just say "ah" for me. That's awesome. Now go ahead and stick your tongue out for me. Perfect. And then moving on to mouth. Now let's move on to the throat portion of the exam. Or no, we just did throat. Let's move on to the neck.
Okay.
Okay, so I'm going to assess the neck, the external appearance, looking at the great vessels, the musculature, the trachea, and the thyroid, looking at the external appearance. And now I'm going to touch some certain areas on your neck, and I want you to let me know if you feel any pain. Or okay?
Sounds good.
Okay, perfect. So I'm assessing the neck triangles, the vessels, and the trachea, and you're not feeling any pain, discomfort, anything like that. Okay, now I'm going to assess the thyroid gland. So I'm going to have to step around you for this one and just put my arms around your neck, if that's okay, okay?
Okay.
Good, and then you could just do a big swallow for me. Oh, wonderful, okay, perfect. Now I'm going to touch and palpate some of your lymph nodes.
Okay.
Just again, let me know if you feel any pain or discomfort with that, okay? So let's do submental, submandibular, tonsillar, preauricular, postauricular, superficial cervical, posterior cervical, deep cervical train, and supraclavicular.
Okay.
All good? No pain? Good. Awesome. Okay, so that completes the neck portion of the exam. Now we're going to move on to the lungs and thorax portion of the exam. So I'm just looking at your overall color, noting if I see any abnormalities with that. I'm also, at the beginning of the exam, I tested for your respiratory rate, but now I'm just looking to see if you seem to look like you're having any problem breathing, the depths and effort of your breathing. Everything looks good. So now we're going to move on, checking the color and contour of your chest. So let me just look at that, perfect. Or shape and contour, sorry, shape and contour of your chest, that's good. Okay, then looking at your chest wall movements, all that looks good too. Okay, so now you can slip your gown back on for me, that's perfect. We'll make sure you're comfortable. We're gonna perform the posterior chest portion of this lung and thorax exam, okay? So let me just go ahead and grab a couple things while I'm over here. I'm just gonna come around your back. If you could just, cross your arms, that's perfect. Good. Okay, so first I'm just gonna touch and feel on a couple areas down your back, okay? And just let me know if you feel any pain or discomfort when I'm doing so. Good, all good, perfect. Okay, now I'm gonna test your chest wall expansion on your posterior. So if you could just take a deep breath in and out. Just go ahead and open your mouth too when you do it. Okay, another time. Okay, that's perfect. Okay, so now I'm going to assess the tactile frematus of your posterior chest.
Okay.
So when you feel my hands rest on your back, I just want you to say toy boat, okay?
Okay.
Ready?
Toy boat, toy boat, toy boat, toy boat.
That is perfect. Okay, now I'm going to assess the percussion of your posterior chest, okay? So my hands are just gonna move up and down your back in like this ladder-like pattern. You just continue to breathe like normal, okay?
Okay.
Sorry, I'm gonna move this up just a little bit. Good. Good. Okay, now I'm gonna test the oscillation of your back. And so I'm just, when you feel my stethoscope rest on your back, just take a big deep breath for me, okay? If you ever get lightheaded or dizzy, let me know. We can take a break, okay?
Okay.
Okay, perfect. That was awesome. Okay, now I'm going to perform the anterior chest portion of the exam. I'm just going to follow the same sort of pattern over here too, okay? So first I'm just going to press around on portions of your chest and just let me know if you feel any pain or discomfort, okay?
Okay. I'm good.
Good. Okay, now I'm going to your chest wall expansion on the anterior chest too, okay? So if you could just take a deep breath for me. Nope, go ahead and open that mouth too again. Okay, that's awesome. Okay, now I'm gonna check tactile fremitus of the front of your chest too. Again, when you feel my hands or see my hands even, just say toy boat, okay?
Okay. Toy boat. Toy boat. Toy boat.
Good. And then we're going to perform test for the percussion of your the front of your chest too. So
Okay.
I'm just gonna move my fingers up and down like I did with the back, okay? Oh, get that one again. Okay, perfect. Same thing. I'm just gonna oscillate. So when you feel my stethoscope on your chest, I just want you to take a nice deep breath, okay? You can go ahead and keep your mouth open for these. Sorry, do it again. Let's go here. Okay, perfect. And that completes our physical exam for today.
Yay.
Thank you.
Thank you.